Hi there, welcome back. In today's video, in this tutorial, I just want to show you how you can simply locate and find the most difficult veins whenever you are performing venibanja or phlebotomy. So before you start, make sure you gather all the necessary supplies that you need for you to perform the procedure. For instance, you may need an alcohol swabs. So this is an alcohol swabs for you to clean the vein. You may need a syringe depending on the size you're gonna use. For example, we have the 10 ml syringe, we have the 5 ml syringe. You will need a 21 gauge needle, or you will need a 23rd gauge needle. You will require a cotton wool for you to apply pressure on the area where you have given the shot. You will need a gloves for you to apply as a TNQ. Okay, before you start, make sure you start by introducing yourself to the patient. For instance, hi, my name is Dr. Dawood. I am going to perform Vinibanja. Are you ready?
Yes.
You have to gain consent for you to continue fast. Then what do? Make sure first you clean your hands. Ensure first you sanitize your hand with an alcohol swabs. Make sure you clean and dry your hand before you start the procedure. Then what you do, you get a examination gloves. Then you have to wear the gloves first. Make sure you don the gloves first. So ensure that you don the gloves before you start the procedure to prevent cross infection. Then what to do, make sure you select the appropriate hand of the patient and you ensure that the patient is comfortable wherever he's sitting. Then what you do, you get a TNQ, you start by applying a TNQ. Then when you apply a TNQ, make sure you do retraction. So you have to do retraction, you have to palpate and feel the vein first. Then whenever we are doing a phlebotomy, we have different types of veins that we always select for drawing blood. For instance, we have the median antecubital vein that is anterior of the elbow joints. So this is antecubital vein that we always use for drawing blood. We also have cephalic vein. So we also use cephalic vein for drawing blood that is located lateral portion of the elbow. We also have a basilar vein. So the basilar vein is near major the artery and the nerves. So it's very painful. So we prefer taking blood either the antecubital vein or the cephalic vein. We also have median antebrachial vein. So these are thin and very fragile vein. So you have to avoid injecting these antebrachial veins. We also have veins on the dorsal of the arm. So you can see here. So make sure you do retraction for the vein to be very visible for you. You can see. So these are the dorsal hand of the veins. You can also take blood here, but we prefer taking blood on the median cubital vein. So how are you going to locate the most difficult vein so that you can identify the appropriate and select the most suitable vein for you to draw the blood? So why do veins most often look difficult? This is because in some cases most patients they have genetically predisposed veins, so they are problematic in finding the vein. In some cases the patient may be dehydrated, so if the patient is dehydrated the vein will be very small and they are often hidden, so it will be very difficult for you to locate and find the vein. So what you do, make sure you feel, you palpate and feel the vein. Then what you do, you get an alcohol swabs. Make sure you clean the vein first with an alcohol swabs. Make sure you clean the vein first with an alcohol swabs. Then what you do, you allow for some time to dry the skin. Then what you do, then another thing you are supposed to consider is you have to consider the syringe together with the needle. So When you see here, we don't have any feasible vein, so we're gonna use the 23rd gauge needle, the smaller size. Then what you do, you remove the syringe from the packaging. Make sure you remove the syringe from the packaging. Then what you do, you get the 23rd gauge needle, you remove it from the packaging, then you attach it into the syringe. Then what you do, you get the patient's hand, then you have to feel the vein so that you can easily withdraw the blood. So this is very difficult to locate the vein. Make sure you retract back the skin and you feel, trace the best and suitable vein so that you can draw the blood. So you have to do retraction. So you have to do a lot of retraction for the vein to be very visible for you. So you have to do a lot of retraction. Then what you do, you remove the needle from the cap of the syringe. Then what you do, you insert 15 to 45 degree angle deep into the vein. You hold the cap of the needle, you pull back the plunger so that you can easily withdraw the blood from the vein. So let us proceed. So this is how you are going to find. I hope there's no any feasible vein, but I just wanna use the simple trick so that I can easily withdraw the blood from the vein. So this is, you have to do a lot of retraction because the veins are very problematic to find them. Then what you do, you insert 15 to 45 degree angle. Then what you do, you apply your thumb on the cap of the needle, then you pull back the plunger. So this is how you are going to withdraw the blood. I hope I have applied the basic technique in finding the most difficult veins in times whenever I'm performing phlebotomy. I hope you can see it's very simple. So this is how you are going to identify and trace the most difficult vein whenever you are performing phlebotomy. Then what you do, you release the plunger. Then what you do, make sure first you release the tourniquet. When you release the tourniquet, make sure you get the cotton wool. You have to apply pressure on the area where you have given the shot. Then you slowly remove the needle from the vein. Then you instruct the patient to apply on the thumb. Then what you do, make sure you attach the cap of the needle. So this is how you are going to perform phlebotomy, the most difficult vein. I hope you find the video very helpful. So please don't forget to subscribe, like and share and give your comment to this video. Thanks for your watching. See you in the next video.